be finer than to be in Carolina in the morning.
Nothing could be finer
Than to be in Carolina
in the morning.
Hi, I'm John Malos, and welcome to this special edition of Connect with Me here on the showroom floor at Ventura TV. Today we're talking to two paramedics from American Ambulance. We're going to be talking about CPR. We're going to be talking about, hey, if you're having cardiac arrest and they need to pick you up in the ambulance, we'll tell you what they do, what equipment they have inside the ambulances. American Ambulance is around the corner. Stay tuned.
Tonight I want to discuss the importance of the television medium to the American people.
No question about it, today is an Ask an Expert day because we have American Ambulance in our house, two paramedics. Now, you might recall a couple of months ago we had the general manager of American Ambulance in our studio talking, Todd Valeri, but he was mainly talking about the business aspect of it and what it costs to run American Ambulance. Of course, American Ambulance serves two counties, Fresno and Kings, the only service in those two counties. But it all begins, as you well know, that if you get in trouble or a relative gets in trouble, a family member, whatever, a friend, it begins with that phone call to 911. And where does that phone call go? Let's go to the videotape and I'll show you exactly where that 911 call goes. It goes right here to the call center, the dispatch center, located at Fresno County Main Yard on the grounds at the Fresno Fairgrounds, just down the street from Ventura TV on Ventura Avenue. And this is the place where it all happens. The dispatchers, anywhere from 15 to 16 dispatchers on duty at one time. As you can see right there, a young lady, I videotaped this a couple of months ago. She was taking an emergency call from someone that was having possibly a stroke at the time. She remained very calm. She had 4 monitors in front of her. Each dispatcher has anywhere from 3 to 4 to 5 monitors at one time that they have to look at. So just so you know, those monitors up there that you see now, they're not watching NFL football or basketball or whatever. They are doing their very important job. They work 12-hour shifts, and as I said, if you get a panic phone call from someone who is in a panic type situation, they're having chest pains, they're having a possible stroke, the person on the other end of the line, that dispatcher, has to remain calm. Live in our studio right now is Kristen Hill. She is a paramedic for American Ambulance. She is also on the Skylife helicopter, and her partner Kevin McCLAIN, a paramedic intern, EMT, and on the rescue team. Today we're going to ask them what equipment they carry on those ambulances. We'll talk about what they actually do on their job to try to save lives. We'll talk CPR. They have a cardiac monitor here on our desk. We'll talk about that and much more. Today it's Ask an Expert on Connect with Me. It's American Ambulance. We're back in just a moment.
Frigidaire. We introduced the first home freezer, the first pulsator agitator washer, and now we introduce the Frigidaire Orbit Clean dishwasher, designed with a unique wash arm that gives you 4 times more water coverage for a consistently better clean. Frigidaire, over 90 years of legendary innovation.
See the full line of Frigidaire appliances at Ventura TV Electronics and Appliances.
You know, this is a very important show, one of the most important topics that we've ever covered here on Connect with Me on Me TV Fresno. We're talking to two paramedics from American Ambulance. And if you have small kids, if you have a relative in the house and you don't know CPR, this is the program that you want to watch tonight, because it could help save a life. We joke around a lot on this program, but this is kind of a serious topic today. So it's time to introduce Kristen Hill and Kevin McCLAIN. Good to see you both. Thanks for being here. Thanks for taking the time. Kevin, good to see you. How are you? Let's talk about the cardiac monitor first while we have the time. Explain what it is, what the function is, and how it all works.
Well, this is an advanced life support piece of equipment. So being a paramedic intern and EMT currently, I'm going to kick this one back over to Kristen because this is one of the coolest machines we have, but it is very, very complex.
This is what we call our cardiac monitor. Any patient that we feel might be in jeopardy with their heart or something going on with their heart, we put them on this. This machine will actually let us read the electrical activity of your heart.
Now, when you say put them on this, do you put the leads on them?
Yes.
These
Okay.
are the leads. Yeah, we've given you a clue word there. And these are just wires that connect to parts of your body with little stickers.
Like the arm, the leg, the chest.
Right. Preferably as close to the heart as we could get. So sometimes we'll go below the navel and then up here in the shoulders.
So what does this monitor? Does it monitor your heart rate and your blood pressure?
Yeah, these leads or these wires themselves, this only monitors your heart rhythm, your heartbeat.
Okay.
It shows a printout of what the electrical activity in your heart is doing, and it
Okay.
will also give a rate.
Okay,
For what
the
it
heart
reads,
rate.
but we do
Not
have
blood pressure at all.
no, we do
Okay.
have a blood pressure
separate-
cuff in
okay,
there that will also
okay.
read on the monitor.
Oh,
But these
okay.
wires themselves only show us what's going on with your heart.
Interesting.
So what we have right now, we have it connected to a rhythm generator. I believe. Let
And
me
as
turn
you
it
can
on.
see, yeah, it's on. And we
Oh.
have a normal sinus rhythm. Well, we kind of got something.
Turn it a little bit, Kevin. More square toward the
Okay,
camera
there
there.
we go.
you
Yeah.
go.
And
Perfect.
you can see our heart rate, which is down there, is 72. And these lines right here are indicating that we have a normal sinus rhythm, we call it in the medical field, or that the electrical activity of your heart is acting normal. If we switch it, because no one here is having a heart attack or any sort of cardiac
God.
issue, thank goodness. This is also showing a normal sinus rhythm, but as you can see, the heart rate has dropped to 40, which can be a very, very life-threatening event. And the complex, we call it, has grown, has gotten wider, and that normal sinus rhythm is now what we call a bradycardia.
All right, the line that goes up and down, what is that?
Well, these lines all indicate partially how the blood is moving through your heart. So this first little wave they call a P wave, and then it just follows the alphabet, Q, R, S, and a T wave. And those all indicate the blood moving through your heart. So in a sense, in a way, yes, it's just electrical activity, but we can also tell you how effectively is blood moving through your body.
All right, let's take that shot again. And the bottom line is your heart rate, as you said, right?
The green line, yeah, or the green here is your heart rate. You can get that by printing out this as well. But what you're seeing in the purple here is respirations, and we don't have anybody breathing for us, but the sensor might be picking up so much as air movement or something like that.
All right, now you have the patches on the side there. Pull those out and explain. We'll have Kristen show us what to do with these. Kristen, these are patches that you put on the chest for what?
These are gel pads that we put on a patient's chest and back, or two areas of their chest. If they're in a rhythm that is life-threatening,
You
that
give them the
we
shock
need to shock
treatment.
them.
Okay,
Yes.
and hold those up. You put one here on this side, maybe put one on
Yes,
that side,
they have
right?
some fail-safe pictures to show you exactly where they go.
Okay.
This one actually can go up here on your chest on the
Okay.
right side, and this one just kind of right over your heart on the left side.
All
This
right.
one can also be placed on the back.
Okay.
And if we need to shock somebody out of a rhythm to hopefully get their heart stabilized into a normal rhythm, what initially showed on the monitor, then that's what we
And
do.
you can't put this over clothing. You have to tear the clothing off. Is that
Yes,
correct?
Yes, we typically cut the clothes off, expose their chest completely, make sure that there's not anything that can interfere with the gel or
Now
the
these
electrolyte activity when it's
have
shocked.
leads as well, and this hooks up to that cardiac monitor, right?
Yes.
And
Yeah.
that's how you use the shock system is through that monitor, right?
Yeah.
Okay.
Yeah, this connects to this piece right here,
Oh, I
connects
see.
to that. Actually, it goes around the other way.
Okay.
And then we can set up the monitor to read through the pads. So now we're going to see their heart rhythm or their electrical activity printed out on there through the pads, so that if we need to do any shock therapy, we see it conduct the shock, and then we see it, the rhythm that they go into afterwards.
You've used this before?
Yes, I have. A
How
few
about you,
times.
Kevin?
Yeah.
You have.
Been a part of the team that's helping.
Let me ask you, have you ever had a patient pass away on you after using this?
Typically the patients that we use this on, they are already not alert. They're unconscious and they're very unstable.
Yeah.
So yes, I have. I have used this on patients who were not able to get them into a stable rhythm or get them awake.
You
But
could
I've
not
also used it.
resuscitate them, in other words.
That's correct.
Yeah, and they did pass away.
Yes.
Okay.
But I've also used it on patients that
You've saved their lives.
have saved their life. Yes.
Yeah. So this thing is a lifetime, and you can't. I mean, so this all this equipment that we're looking at right now on this desk, as we take another picture from this angle here, this monitor here is carried on each and every vehicle.
Yes, it is on every ambulance. It is carried on the gurney and goes into the house with us every time we go to somebody's house.
Right. All right. We're going to take a quick break here, collect our thoughts and catch our breath here. We're talking with Kristen Hill and Kevin McCLAIN. They're both of American Ambulance. They're showing us some very important equipment that they carry on board the ambulances when they show up to your house or your apartment or whatever. We're back with our guest in just a moment.
Weeknights on MeTV. Who loves you, baby?
You shouldn't ask.
It's Kojak
Well, it sounds like music to my ear.
on MeTV.
Look at me.
Why do we love him?
Maybe it's the way I comb my hair.
Or maybe it's his trusty right-hand man.
More bite? Cracker! Cracker! Cracker!
Well, I just wanted to hear how it sounded.
Telly Savalas is Kojak.
Story of my life, baby.
Weeknights at 12:30, 11:30 Central on MeTV.
Who loves you?
And we are talking with two members of American Ambulance, two paramedics, Kristen Hill and Kevin McCLAIN. So what exactly is your title, and what do you do?
I am a paramedic with American Ambulance. So
Okay.
anything that involves, I respond to every 911 call. I usually have an EMT partner in this case.
So he's an EMT, which means what?
Emergency medical training.
Okay.
So it's more
He
basic
assists
training.
you.
Yes.
Okay.
Yes.
You're the main person. He follows your lead.
He is essentially my right hand.
Okay.
Yes. The paramedics and the EMTs who are partners on an ambulance work very close together. It's important for good communication, for good rapport, because in our particular system, every 911 call we go to, the paramedic on the ambulance essentially is the only paramedic on the scene.
How much training, how much schooling do you have to have, Kristen and Kevin?
Any paramedic program is usually 1.5 to 2 years. When you count the book time, the classroom time, you count your clinicals in a hospital, and then the internship training that you do on the ambulance.
And what about the hours that you put in? Let's talk about that.
Yeah, you know, I'm a paramedic intern right now, so not only am I an EMT, but I have a paramedic intern card, which is my hours. We work 48 hours a week standard, so that's usually 2 12-hour shifts and 1 24-hour shift,
Yeah.
or we can work 4 12-hour shifts as well. A lot of people don't understand that about our job. And then when I'm training, when I'm a paramedic intern, all those hours are done on top of my 48 hours a week.
Right.
So, you know, I'm gone from home a lot, John. You know, about
Yeah.
90 hours a week I can be away from the home.
Not for the meek and the weak.
No.
Not for the old. I know you're what? You're 19 and you're what, 21?
Of course.
That's why you can work those kind of hours. Anyway, no, I'm just kidding. So it took years of training. It took quite a long time. And so I want to roll a videotape now and talk about what you come upon when you come upon a scene and what priority number one is for you. Videotape is rolling behind us. By the way, there is the corporate headquarters at 41 and Tulare. That is American Ambulance, in case you didn't know it. The American flag flying very proudly above the building there. Hey, there's Justin, one of the paramedics, and there's Jessica. This was a call that we got for downtown Fresno at a nursing facility here. But talk about what's priority number one as we take a look at this video here.
Priority number one for any 911 call is the scene secure first. Half the time we don't know what we're walking into. Sometimes we don't know the complaint of the patient, and every scenario is different. So depending on whether it's a skilled nursing facility, whether it's somebody's house, there can always be hazards that can be detrimental to us so that then we can't help you. So that's the first priority when we arrive on scene.
And do you follow her lead? You follow her command for the most part?
I would say yes. I think the cool thing is about our partnership is that we're just another set of eyes. I'm sometimes she's showing me something that I didn't see, and other times the important part of an EMT is to show their paramedic something that they may have missed.
But just to get straight in my own mind, in the viewer's mind, there is a lead guy. You're not a guy, but I'm just saying there is a lead person, and in this case it would be Kristen.
Yeah, and she's actually being really humble because she's not only just a paramedic, but she works on our Skylife team as well.
We're going to get into that. Yeah, I know. We're going to get into that because we do have some video of that too. But priority number one is your safety.
Yes.
Okay, and then once you enter the scene, then you know what you're faced with and you go from there.
Yeah.
Based on your training.
Yeah, based on our training, and that can be done as soon as we walk up. What we visualize from the patient, skin signs, how they're breathing, if they appear to be in distress, and then what their complaint is. Get as much history as we can, and if there's anything that we need to do immediately to intervene, then we do that.
If you feel like it's an unsafe area, will you call police or sheriffs?
Absolutely, and I
You
have.
will. You have.
I have. Yeah, we just get on our radio and we ask our dispatch that we need PD out there, code 3, or we need them, to respond for whatever reason.
Because you have to keep yourselves safe as well.
Right.
Absolutely.
The tiered response system that we have here in Fresno is unique. I'm from Southern California and she's from a different part. And a lot of us came here because what we do in Fresno is so special.
But here's the thing. What if you're entering gang territory in Fresno? No, I'm serious.
Yeah.
I'm being serious about this. And you're
serious
putting
matter.
yourselves in danger oftentimes to try to save someone's life.
Yep.
Well, typically when somebody calls into 911, and based on the complaint, our dispatchers are trained in asking certain questions, and if they feel at all like the scene is unsafe, whether it was an assault, if the person is still there, a lot of times we'll respond to a call and then they'll ask us to hold back until PD goes in and clears the scene.
Under the guidance of PD, okay, now it's safe to go in, give CPR, whatever. You're not just blindly go into a scene not knowing what you're faced with.
Yeah. But there are times, though, that our dispatch isn't able to get that information because of a language barrier, or they're not getting a complete picture from the person who's on the other end of the line. So, I mean, there's still calls that we go to that we get for a laceration, which is a cut, and it turns out to be a stabbing.
Now, see, she can appreciate this question more than you. Have you ever helped someone give birth?
I have. Several times, actually. I've delivered, I believe, 4 babies in the field.
Wow.
Yes.
And you were saying earlier you actually delivered a baby while you were pregnant with your own.
I did. I did. I delivered a baby when I was about 7 months pregnant.
Oh, my gosh.
In the back of an ambulance.
Yeah. How long ago was that?
Oh, it was a while ago. My kids are 5 and 7 now, so it was, I think, with my first. So
just
7
amazing.
years ago.
All right, I want to take a look at this video here, the Safe Lift video. It's CPR, because we're going to talk about CPR, a very, very important topic. And the CPR part of this is part of your training, and anybody can come into American Ambulance and get this kind of training. What are we looking at here? Is that the Heimlich maneuver?
No, this is actually,
that?
we call this a knee-chest maneuver.
Oh, okay. Sorry about that.
No, that's okay. And it's just a safe moving technique to get a patient over to the gurney, as you can see, and safely get our patient on our gurney into the hospital without compromising our backs.
Oh, I see. So this is the proper way to lift someone.
This here is a chair lift, is what you're looking at. So this chair lift is, we call this a rescue seat. That's really handy. When I'm responding to a call, maybe, for instance, at the Save Mart Center here in Fresno or something with a lot of stairs, those can just be a lifesaver because even to us, we call it, those are our lifesavers.
Right.
Because they're saving our backs and essentially our careers to get a patient safely out and doing it in a safe way for the patient.
Look at that, going up and down the stairs.
Yeah, what you're seeing there is what we call full C-spine precautions, or actually partial C-spine precautions. I don't see them in a C-collar, but yeah, they're on a hard backboard.
Right. Well, we want to talk about CPR too. That was very interesting. The proper way to lift somebody. If you don't know how to do it, don't lift them. Wait till they get there because they know how to do it. They're trained. We're talking with Kristen Hill and Kevin McCLAIN of American Ambulance. Back to talk about CPR in just a moment.
Ventura TV Appliance Center. We're the save energy, save time, save money place. The Energy Star qualified, ready steam equipped, high efficiency Frigidaire affinity place. You heard right. Right now, save big on select Frigidaire laundry pairs and pay no interest when paid in full within 6 months. At the hometown low price, think outside the big box place. Since 1951, Ventura TV Appliance Center. We're working hard to be your place.
And we're back with our two guests from American Ambulance talking about the proper procedures on how to lift. Hey, we talked about the cardiac monitor. Now time to talk to Kristen and Kevin about the the proper procedure as far as CPR is concerned. And Kevin, you have a CPR mannequin, they call this, with a mask over there. You mean you're not going to go mouth to mouth with the mannequin? Come on, Kevin.
Now, I realize most people aren't going to have this just sitting at home, and it's...
Now, do you use that device over a real person?
What do you mean?
With a real person?
With a real person,
Yes.
absolutely. This is a mask that seals over
Really?
the nose and the mouth. And typically we have a bag that would connect to this
So you don't
as well.
go mouth to mouth on a person.
Not
You use a
anymore.
mask like this.
Right,
Oh,
right.
okay.
So there's actually a technique we call a C technique. It's kind of hard to do it from a seated position like this, but you can really get a nice seal around someone's nose and mouth and deliver really nice breath that will give you good equal expansion, chest rise, so we know the person's getting some sort of oxygen.
Okay. Now, the proper CPR procedure is what if someone needs it?
My favorite thing to tell people right now is if you took a CPR class and you think you kind of know what's going on, a lot has changed even in the last year. It used to be ABCs, airway, breathing, circulation. Now we say CAB, or circulation, airway, and breathing. And we're putting in...
Why has it changed? Circulation, air, and breathing. Why in that order?
If you are not circulating blood through the body's not getting oxygen. Blood carries oxygen. So we need to get that blood to the organs that we want it to get to. So when you do CPR, if you don't have training, first of all, our dispatch will help you do that.
You know what we'd like to do is maybe pull out on that camera a little bit. Pull out on that camera there. There we go, right there. Just a little bit so we can see it. Go ahead, Kevin, and try to talk as directly into the mic as you can.
All right. In this case, we have a patient here who's unresponsive. So we'll assume that they don't have a pulse, okay? And our dispatchers might be walking you through CPR.
Give the full demonstration here.
All right, sounds good. So you can find the appropriate spot by following up the rib cage to a line right here called the xiphoid process, and it's going to move up to mid-sternum basically, or we're kind of right in between somebody's nipple line, and you go ahead and expose it and you go down, and the idea here, John, is hard and fast. How many
times?
30 times, and then we're going to breathe twice.
Okay.
So we're going to go down 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to stop. I'm going to 30, but notice that I went all the way down and all the way up. Good recoil. So let's say we're coming to 28, 29, 30. Now we're going to breathe.
Then I would take 2 breaths. And then he would continue again with the chest compressions.
So this is a 2-person operation?
You can do it with 1 person.
Okay.
The ratio doesn't change from 1 person to 2 person. So it's always a 30 to 2. So 30 compressions, 2 rescue breathing. The idea
this is for an adult, right?
For an adult, yes, for an adult. And
I'm happy you brought that up because a lot of times people think that children are just little tiny miniature adults, but they're not. They have different heart rates, they have different blood pressures, they have things that change them internally where they're required a different type of CPR. So for like a baby, for instance, we're going to do 15 compressions and then we're going to breathe for them.
The idea of starting with compressions first is because when somebody has a heart attack or somebody goes down and their heart is no longer breathing, they already have an oxygen reserve in their blood. So the idea of starting with the compressions is to get that oxygen flowing blood circulating and then to give them the breaths.
Yeah,
so if anything, the biggest thing that they stress is the chest compressions, even if it's somebody that you don't know.
How many compressions for a child, depending on the age? Before you give 2 breaths.
Well, for a child, it's 15. A child and infant, it's 15 and then 2 breaths. For an adult, it's 30 compressions and then 2 breaths. But the idea is to get in 100 compressions a minute.
100 compressions a minute.
Hard and fast. If you don't know what you're doing, the very least you could do is pound on somebody's chest. And I say that word pound loosely. Find your sternum and press down hard and fast.
The sternum is the hard plate that goes down the center of your chest. And the idea is to be along the nipple line on that hard plate of your chest.
Okay. So it's a lot of work to try to save someone's life, and it works.
It does.
It does work.
It does. I would not say it's a lot of work because it is
Well,
fairly
100
simple.
compressions a minute. It's, I mean, you're
sweating.
working,
Yeah,
you're sweating,
you are
and you're
sweating.
working, and you're panicking, and you're panicking. Would you say not?
Well, I think that's the cool part about our job is we're good at not panicking, and
Right.
I realize
But a
most
normal
people
person-
would
Yeah.
be panicked. And I think the important thing to remember or remind yourself if you ever have to do this in a situation like that is you're doing the best thing you could possibly do for them in that situation of their heart stopping beating. You're beating their heart for them, and it's really rewarding.
Right. Now, if someone out there is interested in taking CPR classes, where can they do it?
American Ambulance provides the course. You can come into our headquarters and you can speak with the secretary that's right there and set yourself up with a class. You can go online to AmericanAmbulance.com and sign up to take a CPR class. I can't stress that enough because if somebody you know goes down in front of you or their heart stops beating, they have a heart attack in front of you, it is... it does work up a sweat doing this, but something is better than nothing. And the sooner that circulation is started, even before we get there, the better chance they have to survive.
And something's better than nothing. John, you said you're not CPR certified. Well, now you know. You can go nipple line and press on somebody's chest and try to get to 100 in 1 minute. If you're not even CPR certified, you're protected by laws like Good Samaritan laws and things like that. If you have that knowledge and know that their heart is not beating and you can beat their heart, you can help their heart beat for them.
Yeah, and the compressions start that circulation going again.
Right.
And then the breath is the second part of that equation, of course, no question about it. Some very, very important tips. And these CPR guidelines, they're changing all the time, it seems, huh?
They're changing all the time, and usually a CPR certification is good for a year to 2 years, depending on where you go. And it's not too much to kind of keep that updated.
Okay, so keep that in mind out there. Circulation, the most important thing. Do the compressions, 100 a minute, and then 2 breaths after you do 30 of them. Let's talk about Skylife, because you are a part of that. We'll roll the videotape here. We've got a couple of minutes left. Kristen, you can explain what that is. That's the American Ambulance helicopter, right?
Yes, this is the American Ambulance helicopter. We have 2. We have one in Fresno that responds out of the airport, out of Fresno Airport, and then we have one down in Kings County that responds out of Visalia, out of the Visalia Airport.
Now, can you fly the helicopter?
No,
Oh, okay.
I don't fly the helicopter. We are actually partnered with Rogers Helicopters. Rogers Helicopters supplies the pilot, and then we have a nurse and a paramedic on staff for every call, and we respond to life-threatening emergencies as well, car accidents, stabbings, shootings, anything that is that somebody needs to get to a hospital quicker than just by ground ambulance. We also do inter-facility transfers of very sick patients who are on multiple medication drips, who are often on ventilators, and we're breathing for them. So we cover the entire valley, but in our transfers, we respond, we go as far as Southern California, we go to the Bay Area.
Do you need special training to be a part of Skylife?
Well, if you're a nurse, you need your nurse's license, and American Ambulance, you actually have to be a paramedic for 3 years. I've been a paramedic for close to 10 years now, and I've been on Skylife for 3.
All right, quickly now, the vehicles. Let's go to that videotape before we go off the air, because there are a lot of vehicles made by Mercedes. What do you like? What's special about the vehicles that are used by American Ambulance? And here we're looking at many of them in the parking lot over there at 41 in Tulare. We've got a minute left, so make it short.
Being over 6 feet tall, I like the headroom in these. So it's great.
Yeah. But it's a modern day vehicle, right? It's got all of the necessary equipment in there, right?
That's correct. That's correct. Like he said, it gives you the height room, so it gives more operating space for us in the back of the ambulance. It is a smoother ride for patients, so that we're not bouncing along and everything like that as we transport them to the hospital, which is very essential.
Yeah, in these vehicles, you can hook them up to an IV, the patient.
Yes.
Absolutely.
You can't give blood transfusions,
give
but you can
fluids.
Fluids.
We give fluids. We give
Right,
advanced.
drawing blood, you can do that.
Right.
Right, and you can give CPR, as we also talked about. But I sure appreciate you guys coming in, and I'm personally going to post this show and this video on my Facebook page, because they need to know this CPR stuff. And I appreciate you coming in.
Thank you
Kristen,
for having us.
Come
I appreciate
back.
it, of course.
All right, Kevin, good to see you.
Good to
luck
see you
to
too. Thank you so
I
much.
hope I don't see you you know. Hope you don't have to pick me up at my house. Anyway, that's going to do it for us today here on Connect with Me. We're back tomorrow. Have a good one. If you're watching Connect with Me, you must be watching Me TV Fresno. Hope I see you, but I hope not.